Welcome to Mama Soda, the podcast where we dive headfirst into the beautiful mess of motherhood. I'm your host, Monica Eichman, and I'm here to keep it real. In a world that changes by the minute, parenting can often feel like an uphill battle. We all want what's best for our children, but what that best looks like varies for every one of us. Mama Soda is your passport to the unfiltered, unapologetic world of mommy. No perfectly edited snapshots or unattainable ideals here. We're here to share the ups and downs, the triumphs and tantrums, the mess and the beauty of being a mom. Join me as we explore the raw and authentic side of parenting. This is your safe space to vent, laugh, and learn as we navigate the unpredictable journey of raising strong, capable, and independent children for the future. Hey mamas, welcome to today's episode of Mama Soda. Of course, you've got me, your host, Monica Eichman. I'm a stay-at-home mom of 3 lovely children that are shaping my journey through motherhood. Joining me today is special guest Allison Peterson. She is a licensed psychologist that has been in the mental health field for over 20 years. Even with all her knowledge in psychology, Allison too found herself dealing with perinatal anxiety following the birth of her first child. She is going to share with us her experience and how that has continued to shape her life and practice today. Welcome, Allison, and thank you for joining us today.
Thank you, Monica. I appreciate you having me. I love speaking on this topic.
Excellent. Can you start by, before we go jumping into that, just tell us a little bit about yourself and your family as it is now?
Sure. Sounds good. Well, I am the proud mama of a 14-year-old girl and a 12-year-old boy. And the two of them, along with our 2 dogs and my lovely husband, live in Ridgefield, Minnesota. And my husband and I are the owners of Mindful Families here in Edina. And so here I work as a licensed psychologist as well as the clinical director of a small group practice called Mindful Families. And like I said, my husband is an integral part of that at this point. So
awesome.
That's where we're at now.
Great. So take us back then, just to go through your background in the mental health field, your journey to becoming a licensed psychologist, and how that led to the specialization in perinatal mental health.
Oh, that's a great question. Thank you. So I, growing up, really felt like I was going to be a teacher like my dad and so many other people in my family. I really had and continue to have a passion for working with children. And I had the lovely opportunity in high school of working in a preschool lab situation. But during that situation, I really became aware, because in particular there was a certain preschool age child who was really struggling with stuff going on at home. And it really occurred to me in that moment that how could we teach somebody who's not in the mental space or in the safe space to be able to be taught. And so really from that point on, felt like psychology was much more of my calling. I attended undergrad at Viterbo, which is at the time a college, but now a university in La Crosse, Wisconsin, and completed my master's degree at St. Thomas in St. Paul. And out of school, really feeling like I wanted to work with a team. And so I started working in child and adolescent mental health and residential treatment programs, day treatment programs, and ultimately over the years found myself as the clinical director of a locked residential treatment center where I worked with suicidal and self-injurious adolescents, which I found super fulfilling. And when I became pregnant, it felt very overwhelming to have the responsibilities of a 50-plus hour job per week where I was on call all the time, really dealing with some really traumatic things at work, and then during my pregnancy feeling more and more anxious. So that's where my perinatal journey starts.
So from there, I'm assuming, but I could be wrong, you had your child still before transitioning, or you transitioned before?
That's a great question. So during my pregnancy, as I became increasingly more anxious, I also knew that I had a risk factor. My mother had a severe postpartum depression after the birth of my twin sisters, who were just 2 years younger than me, unexpectedly twins in a small town in southern Minnesota. And so I knew that I had some risk factors. And so being the good psychologist that I am, I took my husband to see a therapist and had her go through with him, what are the signs and symptoms of postpartum depression? So during this time, I really thought, okay, I'm doing all these things to support myself. And then as I went into my maternity leave, I became increasingly anxious. And when my husband suggested maybe I could go back to see that therapist, I was pretty angry and defensive because I didn't feel depressed. I felt irritable, angry, overwhelmed. I wasn't sure that I was really cut out to be a mom. I was pretty sure I was messing this up, and ultimately decided because of my anxiety, I couldn't return to work. And at the time, I wouldn't have called it anxiety. I would have said, I'm doing this for my daughter. I felt like I couldn't leave her. And that was a really hard and painful decision to leave my work as a clinical director. And I had many friends around me say, Allison, you have a master's degree. What are you going to do? You're going to stay home with your kid? Which felt very shaming, right? And obviously in my work now, working with moms who decide to stay home, who are staying home because that's what's needed, moms who choose to go back to work full time and feel good about that, and really trying to honor each mom's journey.
I was going to say, it's definitely a struggle on both sides of the coin.
It really is. And I really thought that everything would be better if I just stayed home with her. And also, as a baby, my daughter was high needs, very colicky, which I know we don't like to talk about, but there is such a thing as difficult babies. And I don't think we talk enough about that, and that gets minimized a lot, particularly at the pediatrician level. But I had an irritable baby, and that irritable baby was making me irritable, and we were kind of feeding off of one another.
Sure.
So I stayed home with her for 8 months. I had a really hard time with breastfeeding. She was born with some jaundice, and I was told, leaving the hospital, she needed to be fed every hour and a half. So for the first 30 days of her life, I fed her every hour and a half because nobody told me when to stop. And I had a friend like 30 days into with some other kids, and she's like, what are you doing, Allison? You are waking this baby to breastfeed? Why? And so I think many factors contributed. My family history, my own type A, high functioning, highly educated personality didn't meet with parenthood super well. My colicky, irritable baby. There were many things that, looking back on it, I can see the breastfeeding difficulties that led me to that perinatal anxiety. And at 8 months, my husband and I decided that, okay, me staying home wasn't actually really good for my mental health. And so I started working just 2 days a week at an outpatient clinic. And with that, and then during that time, there was some natural weaning. And for me, really about 30 days post-breastfeeding, post-weaning, I started to kind of come out of this fog. And I kind of thought, oh my gosh, I lost my damn mind. And I said to my sister, I lost my damn mind and nobody told me. She said, oh my gosh, Allison, we tried so hard to tell you, but you didn't want to hear it. And so there I was, I'm trained as a child psychologist. I'd been working in the mental health field for 10 years. And I was like very confused by this idea that I didn't have postpartum depression, but I knew that what happened to me was not within normal range, right? And so I started to pursue perinatal mental health training during that time that I started outpatient work. I got connected with a local organization called Pregnancy and Postpartum Support Minnesota, which is a nonprofit very dear to my heart, and ended up joining the board and becoming the helpline director, continued with training, and really I've come to believe and know that perinatal mental health is a specialty. I've worked with many moms, dads, parents who have landed in the hands of really great mental health professionals, but who aren't trained in perinatal, only to leave feeling shamed, feeling misunderstood. And so that's really become my mission. In 2013, I left the outpatient clinic I was at and started my own practice, Mindful Families. And that's really been the focus of my work. I continue to see children and adolescents, and I love working with the entire family. In 2017, I was lucky enough to have some of my former colleagues join me. And here we are in 2024, and we're a group of 10 mental health professionals and a psychiatric nurse prescriber.
Wow, that's impressive.
Thank you.
So we've kind of, with all that talk, a couple of the words, I just want to make sure we're all on the same page, myself included. So when we say perinatal versus when we say like postpartum, what's kind of the overlap or the differences when we use those two different words?
That's a great question. So perinatal, really that period starts through the contemplation of a pregnancy, through the pregnancy, as well as a year postpartum. And those are really what we consider like a vulnerable period in the life stage of a birthing person. And any point during that time, a perinatal mood or anxiety disorder can develop. And so we tend to, and thank goodness for Brooke Shields and some of these folks that have really spoken out. We tend to focus on postpartum. We tend to focus on postpartum depression.
Yep.
It's really more complicated than that and can occur in any time during that time. And I will also caveat it by saying that we say a year postpartum, but what that means really is a year post cessation of breastfeeding or of lactation, because it takes a year post weaning for our hormonal levels to return to normal.
Okay, that's super interesting because I'm an extended breastfeeder. All of my children, or my oldest two, have breastfed past 2.5 years. And I'm currently with my youngest at 1 year still breastfeeding. And I would have assumed myself, and mom of 3 here, that I am out of postpartum.
And yet you're not, in several important, like biological as well as mental health ways. So this transition into parenthood or maltreatance, the transition into motherhood, is a psychological developmental stage or upheaval. Sometimes we talk about this idea of developmental crisis. And crisis doesn't necessarily mean bad, but because of this upheaval period of time, it makes us vulnerable to, particularly if we have any type of mental health history or family history, other social factors, it makes us vulnerable to kind of dipping over to or becoming more anxious or depressed. It also sets up risk factors for anybody who has maybe underlying bipolar disorder.
Interesting. So with your experience and your postpartum anxiety, were you then like clinically diagnosed with postpartum anxiety at a point, or is it something that afterwards you're like, this is what I was going through?
I was not, because I did not go in and get assessed. And because of that, I suffered.
I was going to say, so there was no help there.
No. And what's interesting is that I was screened at 6 months postpartum, which all moms in the state of Minnesota have been mandated for some time for your OB, your midwife, to complete what's called an EPDS at the 6-week follow-up. And so I was screened, but what we know about screening is screening's only so good as the provider offering it, right? And so as a mental health person, I knew what the questions were, right? And I didn't want anybody to think it was crazy.
Do you cry more than usual? Do you feel overwhelmed? Those questions?
Oh, yeah, like signs and symptoms. So I think, and that's the struggle, right? Because all mamas are going to struggle with some mood lability or ups and downs in the postpartum time. We talk about the baby blues, right? And so the baby blues occur for 80% of postpartum women or birthing people. And that's where, as we're leading up to the date and time of the delivery itself, our hormones are continuing to increase to a level greater than 200% of what our baseline is. And in the 24 hours post-delivery, those hormones drop precipitously to below normal levels before kind of coming back up. And depending upon lactation hormones, there can be a lot of bumpiness emotionally in those first 2 weeks, tearfulness, laughing, crying. This is the greatest thing. This is the worst thing. And that can be pretty within typical or normal range for the first 2 weeks. If we're continuing to see that beyond the 4 to 6 week mark, this is when we start looking at diagnosing a perinatal mental health issue. And I want to say that I believe strongly that whether or not you meet criteria for a diagnosis or not, you deserve help and support. So it's not just, oh, you met criteria, so you should see a therapist. I believe that all new parents deserve all the support that they can get, because whether or not you're struggling with a mood disorder or not, it's hard. And oftentimes we feel alone and we don't know necessarily what's in normal range or what's not.
This is maybe my own naivety, I loved my OB. I loved my birthing experiences. I've, thought that everything's gone smoothly and great, but we're talking hormone levels here. And as we already know, we're hooked up to machines, our blood is drawn, we're tested for this, tested for that. Is this not something that we could just run through the lab?
That is a great question, but here's the struggle that we have is that people, investors, researchers don't want to put money into researching women's health / mental health, right? We do know, I think we've made some steps towards understanding that a little bit more. Last year, the first oral medication for postpartum depression was FDA approved. I'm not going to pronounce that correctly. It's zerlasiolone.
Okay.
But essentially, it was identified as a treatment pre-COVID, and the initial treatment was a 60-hour hormonal infusion that is given in the first 30 days postpartum that can eliminate, which is like unheard of in research, right? 98% of women within 48 hours of receiving this treatment had no symptoms. So to me, that's like backward science, right? But to me, that indicates like that's how much hormonal levels are impacting mood, right? That a hormonal treatment can correct it. Now, the struggle with hormones in general, and I'm kind of in my later phase of life right now where I'm talking about menopause, is that blood draws for hormones are very tricky because they fluctuate throughout the day. And so to get a sense of like what a person's hormones are doing is very difficult. But yes, so, the midwives and the OBs are looking out for our physical health, right? Are you healing well? How's the lactation going or whatnot? But they're not necessarily trained to look at how's your mental health doing. There's a state mandate that they have to assess you at 6 weeks. And that's been in play since my daughter was born, which was, over 14 years ago. Working with PPSM and as well as with Postpartum Support International, some other national organizations, we have really moved legislatively, and there's now requirements that OBs and midwives also screen during pregnancy, which is super helpful, right? Because we know that a lot of this starts during pregnancy. It may not manifest until postpartum, but oftentimes we can see indicators leading up to the delivery, particularly if we're doing a really good mental health history and looking at a person's risk factors. And now as well, just in the last few years, pediatricians have started screening as well. And many of you might know that, right? Like you're taking your kiddo to the pediatrician for that 1 month, 3 month follow-up, and you're getting this little screening tool.
Yep. And those are just kind of those basic questions.
Yeah, they're very basic questions, right? And so that's why I said before, a screening tool is only as good as the person who's administering it. Just because we have this mandate, right, doesn't mean that really anybody's even looking at it, which quite frustrates me. I've worked with a number of moms who've been very honest on their screening tools, only to hand them over for the nurse to not even look at them, for the doctor to not even comment on it. And part of that is, it's not because pediatricians or OBs don't care. It's because they don't have the training, they don't have the time, they don't have the resources.
I was going to say, yeah, there's a reason that we have different medical fields and different trainings and different expertise. We can't, we don't all do it all.
No, we don't. And that's PPSM and myself have spent a lot of time and hours working with different OB, midwife, and pediatrician groups on how do you screen, how can you do this in the context of your scope and your time, basically so that you're offering some type of warm handoff to a perinatal specialist. And that's really where the helpline was born, was to become a local resource that connected new families and professionals, medical providers, birthing professionals, with trained perinatal folks. And the helpline was so successful that actually Postpartum Support International got a grant through the federal government. I'm going to forget which part of the federal government, but now we have a national helpline that you can call to talk with a helpline, an employed helpline person, because now the helpline is, or the hotline, it's now a hotline, is answered 24 hours a day by a trained person who can kind of talk you through what's going on with you and then help you to identify resources. Because it's a national line, oftentimes then what they do is they connect you back to a local coordinator, and I'm one of our Postpartum Support International local coordinators. And so they will connect you potentially with me or another volunteer who will help you to kind of suss out whether or not you should or you want to be seen by a mental health professional, and then connect you with a mental health professional who has availability, who takes your insurance, who is within your area.
So even still with that, you would have to be at a place in your postpartum journey where you're recognizing and accepting that there might be something more going on.
Correct.
So even if it was like you were and your sisters are telling you, you know, there's something going on and you're not, you know, realizing that, there's still that next step doesn't occur.
Yeah, that's still probably the biggest barrier, right?
Sure.
And that's why I think prenatal education is so important. The AMA Parenting here in Edina, which contracts with the Fairview Hospitals, does a lot of their prenatal, birth education classes. And we've worked with them around incorporating the conversation around, like, what are your risk factors? Here are the signs and symptoms. Because I think that if we're getting parents this information early on, before symptoms are occurring, they're much more likely to recognize, oh, look, this thing is happening to me and it's not my fault. I didn't do something wrong. I'm not crazy. This is a real thing and I happen to be experiencing it. And we know that 1 in 5 moms, birthing people, will experience a perinatal mood or anxiety disorder. 1 in 5 versus 1 in 35 who experience gestational diabetes, which everybody is trained and treated for.
I would say everyone hears about that one. And I would say, you're saying 1 in 5 moms actually goes through it, but doesn't seek treatment or have treatment. Because I know way, way, way more than 5 moms, and I probably know 1 mom that's been diagnosed or treated. Exactly.
And oftentimes, I think some of that too is some of how it's presented in our media, right? So we see cases in the media where this mom with postpartum depression harmed her child or herself. And that's a huge misnomer because the moms that occurs for are typically going through what's called postpartum psychosis, which is extremely rare, is 1 in 1,000 versus 1 in 5. And so oftentimes when moms are experiencing some of these symptoms, they think, well, I don't want to hurt my baby. I don't want to hurt myself. I must not be that bad. And then kind of quietly suffer with sometimes not only anxiety or depression, but also intrusive thinking or thoughts that are kind of unwanted, intrusive fears about what if something bad happened to my baby or to myself or to my partner. And we know that that's incredibly common and often not spoken about because families are afraid that if I tell somebody this thought is in my head, they're going to take my baby away.
I was say, yeah, so we're kind of getting into those myths and expectations of the perinatal struggle. So what would you say are some of the common misconceptions through pregnancy, postpartum, and how to kind of address those?
Yeah, I love talking about that. I think there's so many of them. And a lot of them are, in our media, in our culture, that having a baby is going to be the most joyful and beautiful time of my life. That it's going to look like a Johnson & Johnson bubble bath commercial. And as you know, as a mom of 3, that is not what it looks like. It's a lot of work and it's a lot of wiping butts and getting puked on and things that are not fun. But then what happens is that there's this dissonance where we think we should be joyful. We should be in love with this kiddo 100% of the time from the day they pop out. And yet, oftentimes we're not feeling that way. We're feeling this is hard. What am I doing? I want this kid to stop touching me, which are all normal thoughts and feelings. But because we have these myths about what it's supposed to look like, then people start to feel like, what's wrong with me that this is so hard? Versus, of course, this is so hard. This is so hard for everyone. And talking about that more, I think, is really powerful and important.
Yeah, like you said, people ask, like, what am I going to do or how am I going to do this? And everyone just says, oh, your mama bear instincts will kick in. You'll know what to do.
Exactly. Versus, it's okay to ask for help. Get connected with a village of other moms, of other support people. Go to ECFE, which is Early Childhood Family Education. Get support, because there isn't a handbook. There isn't like this pre-wired instinct that everybody has. I've definitely seen moms who have some of that, right? But even still, there are things about babies and parenting that none of us know. And to get support for that is never a bad thing. But particularly in our Minnesota, like, pull yourself up by your bootstraps kind of culture, people feel vulnerable asking for help. And I think that the more that we have conversations like this, and thank you for hosting this conversation, we invite families to ask for help, to seek help, to know that they're not alone. It's not just them.
Yeah, I was gonna say, in one of my mom groups, one of our favorite questions to ask each other whenever someone's, kind of had that new baby. And now I know that with postpartum going all the way a year after breastfeeding, I'll continue to ask mothers with even older children, but is just, are you thriving or surviving? And just, to kind of pull out from them how they're feeling.
Yep. And I think a good way to do that, or a helpful way to do that, is just, kind of like how I just shared my story, right? And I think that when we share our story, when we say, you know what, I found it really hard, it gives people permission to say, yeah, me too.
Sharing that true story, because like you said, everyone wants to, it's the one up with the social media of like, when is your baby walking? When did your baby start talking? How many words are they saying? So it's like, we're talking about all the good things and the milestones, but nobody wants to share, what their child hasn't achieved.
Right. Or that my baby's still not sleeping through the night, or, it's really difficult to get the baby to latch. I'm really anxious or worried about my milk supply. These are all things that everybody's going through, but very few people are talking about. And so it's kind of like making it okay to talk about the hard things. And you're right, like the Instagrams and some of those things can really portray that, how this all looks shiny and happy. And I see this mom on Instagram looking shiny and happy. She's all done up. She's wearing all her makeup. Why can't I be like that? Why doesn't my life look like that? And because, it's not the truth, right? It's not the truth of what parenthood really looks like. And the more that I think sometimes people are afraid to talk about the reality of how difficult it is. And that being said, like, I think my children bring me the greatest joy in the world and the greatest pain and suffering. That makes my life more rich, because I can accept that both of those are occurring, and that those hard moments are actually the things that get me to grow as a person, as a mother, as a partner, because things are hard and I have to acknowledge that so that I can work through that.
Yeah, as I say, nobody can test my patience the way that my children do, but there's no, like you said, no greater joy either.
And that's why I think when I talk with the moms that I work with about social media, I say, okay, well, what are you feeding yourself and how does that feel in your body, right? So like, there are definitely some Instagrammers, TikTokers, whoever, who are showing the reality of the struggle in a lovely way. And so I encourage the people that I'm working with to like seek those out, right? Those are very validating.
That's my biggest goal here with, the whole birthing of Mama Soda, is show that reality.
Yeah.
That yes, that like life is beautiful and you can have these great things and you can, bake your sourdough bread, but if that's not you when your baby's 3 weeks old, that's okay.
And that, when I work with moms, I always talk with them about that when you're well, your relationship will be well. And when your relationship and you are well, your baby will be well.
Yeah, it's just that. It's all a circle together that, one has to feed the other.
Yeah. Yeah. And I think that, back to that idea of myths, I think that's the other myth that can be really harmful is around, that having a baby is going to bring me and my partner closer together. And the reality is that it's going to challenge you and your partner to communicate and share responsibilities in ways that you've never needed to before. And in the end, that's a really good thing, but it's a really hard transition in any relationship to go from we're each individually meeting our own needs and then we're meeting our partner's needs to now we throw a third person, fourth person, fifth person into the mix whose needs are really overwhelming and important.
And I would say I'm the biggest one with my husband and I with me breastfeeding is he can't put himself in my shoes. But he said to me once, he's like, you can't put yourself in my shoes either. He said, how do you think I feel to have never fed my child? And I was like, oh, like that shook me. I was like, I guess I didn't think about that as I'm selfishly talking about, well, you never have to get up in the middle of the night. He's like, well, you won't pump. You exclusively breastfeed. I cannot. And so it's just like, that was just a wow of like, oh.
And that both of us have different perspectives and different experiences, and they can both be valid.
Yep. And that was the biggest thing of coming, to that realization of, okay, like I said, I can't see it from your way, or I can see it from your way, but I'm not going to experience it that way. And you're not going to experience it my way.
So that's another, I think, sometimes even maybe one of the primary drivers for people to get help is not necessarily because they're experiencing symptoms, but because they're experiencing conflict with their partner. And so I would say the more common phone call we get is we just had a new baby and we're fighting all the time. And when we get mom and dad in the office, we can see that, maybe mom's struggling, maybe dad's struggling. We know that 50% of partners, whether they're male or female, same-sex or heterosexual, will also experience mood disorder symptoms in the postpartum time. So like for me, I really struggled those first 8 months. My husband spent a lot of emotional energy trying to keep me together and our house together and the baby. And so for him, he experienced a lot of anxiety and some depressed mood as I started to feel better because it was a transition for him as well. And I think that sometimes, I appreciate our important focus on the birthing people, on the mamas, and dads are a part of this experience too, and they're impacted as well.
Sure. And I would say, we were talking before with us, a lot of it being hormonal, which then that's a different driving factor, I guess, like you said, because.
Yep, different driving factor. But also, I think, there's and I can share this with you later offline, but on the PPSM, I'm trying to think of the website, ppsupportmn.org, the PPSM website, there's a list of risk factors. And so like for the birthing person, that includes family history, that includes their own mental health history, any financial stressors, any interpersonal violence that's occurring, as well as were there any complications with the pregnancy? Were there any complications with the delivery? Did you have any fertility issues in the past? Did you have a traumatic birth or a baby that ended up in the NICU? These are all risk factors. And so those same risk factors can show up for non-birthing people outside of the hormonal fluctuations that birthing people have.
Sure. So your expertise, we haven't touched on this yet, but includes training in, and I might say this wrong, but it's dialectical behavior therapy.
Yeah, no, you said that correct.
Okay. And then also clinical hypnosis. Now, are those like therapeutic approaches that you use with your perinatal services, or was that something from before?
It was something from before, and I found that it works very well in the perinatal population. And so dialectical behavior therapy was developed in the 90s by a woman whose name is Marsha Linehan, and it was developed for the treatment of borderline personality disorder, which it gets used everywhere now for people who don't meet criteria for that. So I say to my mamas when I give them handouts, I say, And that's not you, so don't go Googling that. But because she did such a great job of standardizing the treatment as well as researching the treatment, has been very well validated in multiple populations, including the perinatal population. And really, I would say, as for as fancy as it sounds, DBT is really just good emotional skills. And if I had my way, it would be taught at the middle school level, because this is when we start seeing.
I get stuff with my elementary student that they're talking about social emotional skills.
Which is great. And I know that our state has really moved, and that started when my kids were little, that the preschool and kindergarten curriculums really much more focus on social emotional skills. But for many of us, we didn't grow up in homes where those skills were utilized or demonstrated. We didn't necessarily get support with how do I identify and express feelings? How do I regulate emotions? How do I communicate effectively what I'm feeling and what I need? And that's really what DBT does. And so there's two components to DBT. The one is the individual therapy, which is primarily focused on the dialectic. And what we just said earlier was a really good example of that your husband can feel left out of feeding and you can feel overwhelmed by feeding at the same time, that two opposites can exist in the same space. And so the dialectic is really, how do we synthesize two opposites? I'm really in love with my baby, and having a baby is really hard. So that when we can accept that I feel both of these things at the same time, when I can create space for how I feel these things at the same time, that's actually where I'm going to grow and change. Versus when I resist how I feel, right? When I'm angry about it.
Because you thinking only one can be right.
Right. When I'm judging how I feel, when I have pain and I don't accept that pain, then I suffer. Being the parent of a newborn has some pain in it, right? And so a lot of what I do then with my moms is work on, how do we accept that the pain that you're in, right? Like, yeah, it's painful that you're not getting enough sleep. But what's more painful, what's causing the suffering, is that you're obsessing about, how am I going to feed this baby to try to get them down for the whole night? What am I going to do if they wake up? How does that help you when you're anxiously waiting for the baby to wake up? And I should have said this earlier, but so I want to make sure that I say this. One of the greatest red flags for me is when I have a mom who is not, we'll screen for like, how's sleeping going? Well, of course, sleeping's not going well. You're up in the middle of the night breastfeeding the baby, feeding the baby, diapering the baby. But what I want to hear about is, are you able to return to sleep after you feed the baby?
Sure.
Because when moms are really anxious, they're on guard, they're hypervigilant, they're looking for, is the baby breathing? Is the baby okay? Those things will keep them awake, right? And that's when I know that their anxiety has crossed into a really critical place where we really need to be addressing it.
Sure.
Well, I should also, clinical hypnosis.
Yeah, I was going to say, what about that?
Yeah. The thing about clinical hypnosis is it's not the same as, I'm going to stage hypnosis. I'm going to make you cluck like a chicken. I don't do that. But clinical hypnosis is really based in this idea that all hypnosis is self-hypnosis. And hypnosis is really about accessing a part of your mind that can restore your mind and your body. And that is, I think, an important skill for all parents to have in terms of how are we nurturing our mind and our bodies through mindfulness, through relaxation, through hypnosis, so that we're giving our brains rest from the heavy work and the heavy lifting of parenting.
So those are both practices that you utilize then within your practice.
Yes, they are. They are. And then the lovely thing about being a part of a group is that we also have practitioners here who offer more trauma-based therapies, like accelerated resolution therapy, which is a form of bilateral somatic stimulation, which sounds like a lot of gobbledygook, but essentially it uses the bilateral eye movements, moving eyes right to left, left to right, can help the brain to process traumatic events. And so we use that a lot with birth trauma, with any trauma that occurred prior to the pregnancy that could affect the delivery, like sexual assault. So we have practitioners that offer that as well, as practitioners here that offer play therapy, so that we can work with our families as their kiddos become toddlers, preschoolers, elementary age, and that we're really supporting the whole family.
So what are some of the key aspects for the transition to parenthood that would catch individuals by surprise? And there's all, like you said, there's these books and there's these classes, but those are all extra. What could we incorporate into like mainstream that would better prepare parents for like that significant life change, or knowing what to look for, I guess?
Well, I think some of that, what I'd like to continue to encourage is that some of that needs to be happening in the medical provider's office, that we need to continue, because that's where people show up, right? They show up with their doctor. And I think that's where the conversation starts, right? But I think bringing the conversation into spaces that already exist, like your mom's group, right? Like ECFE, talking with our friends about it. I think talking about perinatal mental health is an intervention. And so just creating that awareness, I think, is a huge part of helping families to know that it's okay to access help if they need it.
I was going to say, the stigma around mental health is a huge barrier for people seeking help. Just collectively, like just as an everyday person, I guess, what would you say are the kinds of, questions to be a good friend? I don't know. Like, how do we ask those things and then make the mom feel comfortable to like give us that truthful answer?
Well, again, I think that comes back to sharing our very real experience and strength and hope related to that, right? Like, this is something that I'm struggling with, I think is much more effective than tell me how you're feeling. To say, gosh, when I had my first baby, I remember how hard that was to go from my sense of self as Allison, as the wife to Matt, to now Madeline's mom. I think that can open the conversation in a different way than those more direct, how are you doing? Because, here in Minnesota, if somebody asks how you're doing, you say, oh, I'm good, or okay.
My son the other day, God, what did he say? Because the second he said it, I laughed so hard because it's exactly what I say. My husband comes home from work and he says, oh, what's up? And I said, not much. What's up with you? And that's exactly what my son said to my husband the other day. And I was like, exactly. It doesn't really answer the question at all. And it's just, like you said, it's just that natural response versus I like that. Like, it's that opportunity, not that we want to just be in sad times, but to commiserate, really, because it's the truth of what's going on.
Well, and one of the things, I don't know if your kids do this yet at school, but what's your rose and what's your thorn of the day, right? Like, what was good and what was hard about your day? What was your high and what was your low? And just acknowledging that both can exist. And that, I imagine, like, really what you could say to your husband is like, it's been a hard day, and we got out of the house and went to this park, and that was a lot of fun. Like, that both can be true at the same time.
I think that's a good one. And I appreciate you actually bringing that up, because that's very much the way my husband wants to communicate. Like, asking highs and lows of the day is a question that he asks. And I look at him like, seriously? Really? But when we're talking about it like this, and when you think about it, you're like, well, yeah, that's important, because yes, both do exist. And it can be just such a simple win.
Yeah, and it doesn't have to mean we're sitting in all the hard feelings all the time. But if we're never acknowledging the hard feelings, then those feelings are going to get built.
Yeah, and I think when we're talking about this, the reason I get hung up sometimes is I expect then that high has to be something astronomical. And it doesn't. No, my high today, both kids are still breathing. Like, if that's what it is for today, that's fine. Yep. I'm not in pajamas. Woo!
Well, and sometimes that is the biggest win of the day, right? And I say that to all my moms. Oh, well, I failed at this, I failed at that. And I said, well, are your kids still alive? Yep. Did you feed them? Mm-hmm. Did you diaper them? Mm-hmm. Did you hold them? Mm-hmm. Okay, you won. That's all you need. That's all you need. But again, with the
And
expectations,
like, that's a good reminder.
right, in our culture are like that I should be actively engaging my baby all day long. I mean, how many moms have I seen where they're like, I can't put the baby down. And I'm like, no, actually, you can put the baby down. It's good for the baby and it's good for you. And the same thing with toddlers, right? I mean, obviously they need a lot of supervision, but them learning how to play is important, right? And so when we have moms with really significant anxiety, they tend to be very intrusive to their children's development. And I sometimes I use that as a motivator for moms, right? Like, we want your kiddo to become self-independent. We want your kiddo to be able to tolerate distress. And so if you're constantly entertaining or constantly in this baby's space, this baby is going to have a hard time developing sense of self. And there's not like right answers to that, but I think being considerate of that or being aware of that actually it's not my job as a mom to entertain my child 100% of the time, to self-soothe or to soothe my child 100% of the time, because that's not good for them. That allowing an appropriate amount of independence is really important to your child's development.
That's a good reminder for myself. I think sometimes, because I'm like, why won't they do this by themselves? It's like, well, you didn't allow them to do it for themselves.
Well, and that, and I say this to all the parents I work with too, like, parenting is a mind-numbing amount of repetition, and that I will be working with parents of toddlers, elementary school kid aged, even adolescents, and the parents are saying, nothing works. I've said it 100 times. They'll never do it. And I say, the parenting's a long game. It's a long game. You're going to repeat yourself for the next 18 years and then some. So I think that having those realistic expectations around parenting are important too. That just because I told my kid no 10 times doesn't mean that they've learned it yet. And that doesn't mean there's something wrong with my kid or that there's something wrong with me. It means that learning effective and age-appropriate behavior takes a long time, and it takes a lot of predictability and consistency on the parent's part.
Sure. So talking about here, where you're working with families when their kids are, like you said, high school, and that we're obviously out of a stage of postpartum. I'm assuming they've been stopped breastfeeding for more than a year now.
Yep.
So how does that connection for people with mindful families to know, like, that your practice is still a good fit for them, if that makes sense what I'm trying to do?
Yeah, well, and so oftentimes what will happen is that we'll have a new mom, a new family start working with us during pregnancy or possibly postpartum. And then, oftentimes the great thing is that with maybe 6 to 8 sessions, we can really help mom get into a really better place, right? And then sometimes we won't see her. Maybe she'll come back for baby 2, which we usually encourage because we want to just make sure that the additional transition goes well. And then it's not uncommon that we'll have moms call back with, we're struggling with toddler issues. I offer a parenting skills workshop monthly that just kind of goes over those 101 skills, right? Like, how are we creating structure, limit setting, and communicating with our kiddos? We also have 2 play therapists and 2 lovely play therapy offices that can work with kids 4 and up. And then we tend to do some combination of kid one-on-one work with parenting skills, where the therapist is working to support you as the parent to kind of think through, like, what's working for your kiddo, what's not working for your kiddo, what are some other strategies you might try. And then, as they transition into middle school and high school, there tends to be a lot of mood fluctuation that comes along with that transition into puberty. And so just, outside of the families that we've worked with as new families, we have lots of families that work with us during the middle school and high school years, just in terms of helping their kiddos be on the right step or the right foot for good emotional health as they move into high school and into their young adult life.
So as I say, I think just for parents, I guess, understanding that, like, both the parenting is a fluid transition and as well as the development of the child and what they're going through. It's all one thing after another. It's not just, oh, you've completed this stage, you're out of the woods now. Well, now you've just entered another stage.
I'll say just as soon as you feel like you've mastered a stage, your child will develop. And then you'll be like, oh my gosh, what am I doing again?
Yeah, it's just all transitions.
Yeah, a local author, Mary Kuchina, who wrote The Spirited Child. And she talks about this notion, which I found to be true, which is that after that first 24 months of life, we tend to see these developmental shifts in our kiddos at their birthday, at or around their birthday, and then at or around their half birthday. And so really, after those first 24 months, we've kind of been, I don't know, maybe we're following along with the what to expect in the first year or whatever. But then what's interesting is, one, there's not a lot of information after those 24 months, those first 24 months, but that there are a lot of developmental changes and transitioning happening every 6 months for our kiddos. And what we'll usually see around those marker points is we'll see some type of regression, just like that dreaded 4-month sleep regression, right, is happening because the baby's brain is working on what's going to be my next skill, right? And that skill is oftentimes sitting or crawling. And so they're consolidating some of those neural networks so that they can do the next thing. And so they regress on sleep. And then once they've gotten some of those large motor skills, then the sleep skills will kind of come back online. Well, the same thing happens throughout the life of a child. And oftentimes that can happen with growth spurts or cognitive developmental leaps. I know, like with my son, I can always tell when he's about to go through a growth spurt because he'll start walking into things. So it's like he loses some coordination as his body is learning, as his body's growing.
And so I think that's interesting too, when you talked about kind of the ages, and something I've never thought about directly, but I think we do subconsciously, is when we talk about our children up to 2 years old, when someone asks, how old are they? We say in months, because there's all those monthly transitions. You don't say, my kid's 1. Well, my kid at 12 months is very different than a kid at 21 months, And then once they hit 2, we start saying 2, but we do say 2.5, and we say 3 and 3.5. So it's like we drop those months, but like I said, subconsciously, that's still kind of where each of those transitions are happening. With all of that, any specific goals or projects that you have in mind for the future with Mindful Families and supporting perinatal mental health?
Yeah. Well, the first thing, and I've been working on this for some time, so my goal for 2024 is to finish this, but I'm actually been working on a book entitled The Shit Nobody Tells You When You're Pregnant, Postpartum and Parenting, because I think I want to give families a resource about the reality of parenting. We also, as I said before, will continue to offer our Parenting Skills 101 workshop. And then my hope is, we did before COVID, we offered a lot of mindfulness groups for moms around using mindfulness to manage their mental health and their wellness. And my hope is that we will be able to bring that back here in 2024.
Awesome. Well, that sounds fabulous. Allison, thank you so much for being with us. Thank you for sharing your experience with postpartum anxiety and just continuing that conversation with parents, with moms, and trying to kind of move us out of the mental health stigma that we're in.
Thank you so much. And thank you for having this conversation. It's really important. Thank you.
Awesome. And thank you, of course, all of our listeners today, and hope to see you again next time. But until then, keep doing your best. Thank you for joining me on this roller coaster of momming right here on Mama Soda. I hope you enjoyed our candid conversation about all things parenting, where perfection is left at the door and real life takes center stage. Stay tuned for more heartfelt, unfiltered discussions in the next episode. And if you haven't already, don't forget to subscribe, rate, and review Mama Soda on your favorite podcast platform. Your feedback means the world to us. Until next time, this is Monica Eichman signing off. Keep rocking that mom life, and remember, you've got this.